Breathing. Breathing is the energy to our voice. If I take a breath and start talking and let myself run out of air, I notice how the muscles in my voice box start to tighten and become uncomfortable, and my voice becomes hoarse. Good breath support ensures stamina of voice. It supports your everyday talking, making sure you don't run out of air as you speak. Good breath support ensures efficient sound, ensuring that we regularly replenish our breath. Good breath support ensures effective sound, so we are able to easily modify our breath for additional vocal demand. For example, in order to alter our loudness, our pitch, and our voice quality. Breathing for voicing should be relaxed and easy. With good breath support, we can reduce vocal strain as well as reducing the risk of injury to our voice box. See our video on muscle tension and balance for more information. When we look at breath support for voice, it can be helpful to understand the two main types of breathing. Firstly, we have clavicular breathing, sometimes called chest breathing or shallow breathing. In this type of breathing, we are taking air into the chest. We will notice an upward and outward movement of the chest as we fill it with air. The shoulders and the collarbone will lift at the same time as you breathe in. You will feel your abdomen move inwards. When we breathe out, the chest and shoulders briefly return to their resting position. However, this type of breath is short and rapid. It feels effortful to do. Breathing too quickly can result in unpleasant symptoms such as dizziness, faintness, headache, visual disturbance, tingling, chest pain, palpitations, and can commonly become a cause of anxiety. Shallow breathing is often seen during emergency situations when we are feeling stressed or panicked. That said, many people who have a shallow breathing pattern throughout the day are almost always unaware of the condition. If you speak infrequently throughout your day, shallow breathing might not impact on your voice quality at all. However, if you use your voice often, or when it's time to speak, you become tense and therefore use more shallow chest or clavicular breath, the muscles around the vocal cords and in the neck and shoulders and even the rib cage may become tight and tense. Your vocal cords themselves may have to work harder to vibrate, and this can result in hoarseness and discomfort when speaking, as seen in the demonstration at the beginning of the video. Diaphragmatic breathing, sometimes called abdominal or deep breathing, is breathing that engages the diaphragm muscle. This is a dome-shaped muscle which separates our chest from our abdomen. Place your hand below your rib cage and cough. You will feel the diaphragm move. In this type of breathing, we are taking air lower down into the lungs, and as that diaphragm muscle moves downwards, the lungs expand. When feeling your body movements during a diaphragmatic breath, think about how a balloon is inflated. The balloon gets bigger from the front and the back, from the top to the bottom, and from side to side. A deep diaphragmatic breath expands your body in all directions. Your abdomen will move outwards at the front and into your back. You will feel that movement at the side by your hips and also above as your chest gently rises. But notice how your shoulders and collarbone remain relaxed. There will be a brief moment of stillness after the deep breath in, and then we breathe out. When we breathe out, on the exhale, we actively engage the abdominal muscles to push the air out. The diaphragm returns to its resting position and the abdomen will flatten. Diaphragmatic breathing is deeper and more relaxed breathing, and we should be engaging this breathing technique when we use our voice. A diaphragmatic breath gives your voice enough support to keep the vocal cords vibrating with very little muscle effort. It reduces the risk of running out of air when talking, giving more stamina and power to your voice. It avoids tightening the muscles in the throat and avoids excessive upper body tension. If you watch elite performers, such as an opera singer or musical theatre actor, observe their breathing patterns. Observe for the diaphragmatic breath, the abdominal movements, and the minimal movement around the shoulders and collarbone. For in this river all is found. An analogy that can be used to compare the two breathing patterns is a tube of toothpaste. If the tube is very full, just a little effort and a lot of toothpaste will come out of the tube. If the tube is nearly empty, you really need to squeeze to get enough toothpaste out. It's the same thing with air. If there is enough air, the voice will be able to come out smoothly without squeezing any muscles. If there's not enough air, because there's only air in the chest for breathing, your muscles will tense to try and force more air out, resulting in a strained and weak voice quality. In this video, we will practice diaphragmatic breathing. When you see these practice slides, please join in. You may wish to pause, mute, or rewind the video while you are practicing. Before we start the breathing exercises, release any tension in your tongue, your jaw, or your lips. Get your neck in a midline position, not too far flexed forward or back. Your neck and your shoulders in your ribcage should feel free to move. Any tension should be released. See our video on tension release and neck and shoulder stretches for more information. Now become aware of your own breathing pattern. Place one hand on your chest and another on the abdomen and feel for the movements. Watch yourself in the mirror and watch your body movements. Start with good airflow. As you breathe into your abdomen, it will get bigger. As you breathe out, the abdomen will flatten. So breathing in and your abdomen gets bigger. Breathing out and the abdomen will flatten. Don't let go of the breath too quickly. Control the out-breath with your abdominal muscles. Think of a balloon. As you breathe in, as well as the front of your abdomen, feel the sides and around your hips inflate. As you breathe out, feel that space get smaller. Feel the ribcage very gently rise and fall. There should be no big movements around your chest. Your shoulders and collarbone should be relaxed and still. Practice this breath 5 times. If you're struggling to get the abdominal movement, try this exercise lying down. You might want to place a book on your abdomen and when feeling relaxed, watch as the book rises and falls. Practice this exercise little and often throughout the day. Try taking 5 diaphragmatic breaths every hour. To get a consistent diaphragmatic breathing pattern, you need to change how the muscles move, you need to change muscle memory. The key to this is repetition of these exercises. Stop if you feel breathless or lightheaded and try again later. Your speech and language therapist will give you more guidance on how to develop your breath support.